Welcome, colleagues. My name is Brian Morales from the State Department in the United States, and you are joining the Global Coalition to Address Synthetic Drug Threats Sub-Working Group Meeting 3.3. This is for the West Group, the December session of 3.3. Engaging people with, addressing populations in contact with the criminal justice system, including alternatives to incarceration. This is the final session, the December 20th session. Last week, we had our East Group session, and I have a few administrative announcements to start us off today. First, on the topic of civil society engagement. As many of you may recall, when the ministerial meeting launched the Global Coalition in July 2023, a declaration was produced on accelerating and strengthening the global response to synthetic drugs. And at that event, participating governments expressed their commitment to take into account input from civil society and coalition objectives. Subsequent to that, we had these sub-working group meetings established, and then what came out of that was a consensus that we would have these meetings closed to government and international organization representatives. So we've established this alternative plan to be able to engage civil society organizations. That will involve, first, national dialogues with coalition governments from the months of January to February. We are encouraging all of your countries to connect with local organizations and to take notes of those conversations and share those with us so we can post those on the website. The United States will also be having one of these national dialogues on the 27th of January. And the idea will be to engage U.S. civil society organizations through our White House Office of National Drug Control Policy. And so that will be something that we'll be posting more information on as we do that. You can send any readouts or any information of these events that you host to our email address, syntheticscoalition@state.gov. Secondly, we will have the Vienna NGO Committee. Very grateful for them to host a global civil society forum on the coalition work. That will be end of January, beginning of February. Then we will also be encouraging civil society organizations to exchange experiences, sending us videos or other documents that we can post on the website between January to April. Additionally, recommendations on policy initiatives or programmatic initiatives will also be welcomed, and we will also be posting that on the website. From April to July, any achievements, any completion of activities, initiatives that civil society organizations have undertaken will also be posted on the website. And finally, at the discretion of co-chairs, civil society representatives and organizations may be invited to present and participate at specific sub-working group meetings from the months of April onwards. So that's one administrative announcement. The second one relates to our Global Coalition website, globalcoalition.us. You will notice that we have sub-working groups on that website. And in those sub-working group pages, we have the agendas for upcoming sessions. So please check that out to be up to date in terms of what the topics will be for the coming months. We will post those and update those as we sort of develop those agendas, so you can check in regularly. And we will also be posting past recordings as well. So if you've missed any sessions, you can always join you can always visit that website and see those past recordings. Additionally, if you have any content that you would like to share with us to post, perhaps a longer presentation than we have time for during these 1-hour sessions, you are free to also submit it to us through our email address, and we are happy to post those for you on the website so that the coalition participants can also take a look and learn from your experiences. So those are all my administrative announcements for today. With that, I am going to turn it over to our co-chairs to begin our session for today. Thank you so much.
Muchísimas gracias, Brian.
Thank you very much, Brian, for this very important information. Good morning to all of you. Welcome to the group, working group 3.3. And my best regards to the co-chair, Justin Henderson, our best from Costa Rica. we had a first session where we were able to ascertain, based on evidence, how this link between health and justice can help the reintegration of the people that are linked to the criminal justice due to drug abuse. And therefore, due to that, they committed some crimes. So in the second session, we started looking into successful programs that show that, yes, that evidence really confirms that we have to work along those lines. In this third session, we are going to have the possibility of learning within the criminal justice system how these programs are developed and implemented and the results. So without further ado, I'm going to give the floor to the presentation of Jac A from Alternative to Treatment for a Vulnerable Population, and the Director of Community Service, PTCS, for their English acronyms. And he will share for 10 minutes on how to the help that they got from the IDB. I'll give you the floor.
All right. Thank you very much, and
Yes,
greetings.
thank you.
Yep. Oh, go ahead. I'm sorry. Good. All right. Well, thank you very much, and greetings to everybody. My name, as was just said, is Jac A. I'm the Executive Director of TASC's Center for Health and Justice and P.A. I'll say more about that in a minute. First, just want to thank you as members of the Synthetic Drug Global Coalition for the work you do. I do attend coalition meetings, and I know the effort is already paying off and much more is yet to come. So I want to thank you and recognize your leadership. The title of today's presentation is Deflection, creating a long overdue bridge between police and treatment, all for the purpose of what Alternatives to Incarceration does, which is to reduce drug use and to reduce drug-related crime. So I'm going to introduce you to this word called deflection. I'll explain it. It's not really a training on deflection, but set it within the context of the work that you do as members of the Synthetic Drug Global Coalition. Before I get going, I want to acknowledge, of course, all the partners that are on the call who work in and around the space. So I want to start with, of course, INL, and then ICADI, International Consortium for ATI, which is the new kid on the block, as I like to say, doing great and early work in the ATI space. ISIP, Colombo Plan, the Drug Advisory Program, Organization of American States, CCAD, and of course, United Nations Office on Drugs of Crime, all of whom are in and around this work that you're going to see today around deflection. As I get going here, I said I would introduce myself also as the Executive Director of the Police Treatment and Community Collaborative. So when we think about this word deflection that I'm going to introduce you to, if you're not familiar with it, in this pre-arrest space of ATI, think of PTAC as the global voice of the field of deflection and pre-arrest diversion, which is about 10 years old as a field of practice, so still very young relative to many other types of interventions we know within ATI, as well as other types of activities that we do. So with that said, let's go on and get started. I am, of course, going to set today's presentation on deflection within Alternatives to Incarceration, ATI, because this is group 3.3, which of course centers around ATI. If you've not taken the ATI course yet in your country or with your colleagues, I definitely encourage you to. It's a wonderful course, and I will be using a few slides that go with the title slide that you see here. So I just want to set this within the context specifically of this group. This is actually from the curriculum itself. So with that, if you have taken a course, or when you do take the course, this is one of the slides you'll see. And from left to right, of course, this slide describes your country's justice system. It's generic, obviously, but every country we look at has what you see on the left-hand side, which is the pre-arrest space. That's where law enforcement and police operate. The criminal proceeding space, which of course you all know is where prosecutors operate and the courts begin to operate. Jails, if you have those in your country's system. And then on the right, of course, in red is the post-sentencing procedure. And in that area, you have your courts again, you have prisons, you have parole, which might be part of your country's justice system, and you might also have probation there. The point is, this is a generic setup of many, many systems. And of course, the point of ATI, Alternatives to Incarceration, is to create opportunities to divert, to keep people in the community, or if they're in the justice system, to move them out earlier into the community through the use of treatment as a way, again, to reduce drug use and reduce crime. What's interesting about ATI, however, is that the role of police, so the left-hand side, that blue space, the role of police and law enforcement in ATI has not been clear. Sometimes to the point that we kind of can talk about ATI and talk about courts and prisons and jails and prosecutors, all of which is important and needs to continue, and yet we leave out the police and law enforcement out of this discussion. The reason that is, at least the two top reasons I'd like to share with you today around why it is that we've not really thought of police and law enforcement in the ATI world for the most part, is that for a long time, two key issues about drugs, crime, and policy or policing had no good answer. That is, using a street level strategy. So at the street level, we're not addressing the issues around drug cartels, for example, or large scale manufacturing and distribution. But at the street level, police and law enforcement through arrest and enforcement alone cannot do two things. One thing they can not do is stop a person from using drugs or even reduce a person's drug use. And of course, as a result of that, the other thing that cannot happen from local police and law enforcement is they cannot then stop or reduce the drug-related activity and crime from that same drug use. This is where now, through ATI, as part of a system of deflection and diversion, a systems approach to your country's reduction of drug use and drug crime, through the introduction of deflection, now introduces the ability for this to actually happen. The easiest way to explain deflection, and again, this is not a training on deflection, but the easiest way to understand how this could work, how could this happen, that if we engage police and law enforcement on the drug demand side of reduction, not just the supply side or the enforcement side, how could this happen? How is it this possible? And the easiest way to explain deflection is we are not waiting for nor needing those things that you see on the screen right now. We don't wait for nor need an arrest. We don't need a crisis. We don't need a drug overdose or an alcohol poisoning, a situation or event. Instead, deflection says, what if we could get to people early, upstream, before those events that I just happened, before the arrest, before the overdose? And in that way, deflection becomes a prevention strategy about meeting people where they are, which means to law enforcement and the police, meeting them on the streets early on when they see them. And if you're not familiar with it, police and law enforcement see people for quite a number of times, usually before they ever arrest them. There is a space between arrest and the first time an officer sees someone that's actually quite large. They don't arrest everybody the first time they see them. That's a very intuitive and natural way to think about the space of deflection. And of course, if we wanted to talk about alternatives to incarceration, reducing drug use and drug-related crime, why would we not involve the police? Look at this graph that's on your screen. And if you've taken the ATI course again, or do take it, you would see this, this slide, which comes from, in fact, Dr. Peters, who's on the call today, among others. And on the left-hand side, that red bar where it says the percentage of people who at the time of arrest, this is from the United States, have not had access to treatment is 62%. All the other bars that are on here are about people who've had access to some kind of treatment, substance use or mental health. And you can see they're substantially lower. So if we wanted to get closer, upstream, earlier, people who are using drugs and all the issues that comes with it, we would be working alongside police and law enforcement on the drug demand side, which is the new part of this. And of course, you all know this, being experts and leaders in the field, that when we get to people early and get them into treatment, we can reduce drug use, reduce crime, and increase employment. Now, what deflection does then, now that we have the ability to bring police and law enforcement into the picture, is deflection creates new opportunities to reduce drug use and to reduce drug-related crime. And it provides an option for police, which I'll talk about in a second, by safely deflecting people into the community early, upstream, without even entering them into the justice system. When we have then deflection introduced at the pre-arrest stage of ATI, we're able to talk not just about diversion, which occurs after somebody has entered the justice system, but now we can talk about the role of police at the pre-arrest stage of ATI before they've entered your justice system, and importantly, before an arrest has occurred. Again, relying on the fact that your country's police and law enforcement are seeing people many times before they arrest them. We know that, we're familiar with it, and officers are smart. They will tell you that something is up with a person, something's not right. They're not going to arrest them, and that opens up an opportunity for us to act on the drug demand reduction side, but also, more importantly, in relation to the Global Coalition and its work. Take a look at this, where it says Deflection creates this missing bridge, this bridge that now allows us to connect law enforcement for the first time through the pre-arrest stage in Deflection with drug treatment, which is to say we can now connect public safety with public health. And on the scale of the Global Coalition, we can now connect for the first time the work of law enforcement on supply reduction to their work and law enforcement on demand reduction. That's a very exciting development as the result of Deflection. And of course, Deflection, how does it do it? It creates this option for police so that when they're in the community setting, because Deflection is only in the community setting, they might then have an alternative to arrest, number one, that you see on the screen. But more importantly, they have an alternative to number two, also, which is where they're encountering people whose early drug use, and it might be later stages too, but early drug use and challenges they're facing can, instead of taking no action or being arrested, can instead be deflected to treatment, housing, service, and recovery. As I come to my last two slides, as I said, this is not a training on Deflection, but if I were to show you Deflection, this is what it looks like. It's a little bit hard to see, but these yellow outline boxes are the ways that we know and understand Deflection. So about 10 years on, we know quite a bit about it already, and we know there's about 6 different ways to do Deflection. The point of all of it is it stays in community. It allows police a third option on how to act, and allows drug demand reduction and supply side reduction for the first time to be connected together. And with that said, I want to thank you again for allowing me to be here. And of course, I do attend the meeting, so I'll be here at another time, but to be able to present to you on Deflection. Thank you very much.
Muchísimas gracias a ti, Jac.
Thank you, Jac. Thank you for giving us this intervention that could be implemented by the police before the arrest takes place, or the individuals get into the criminal justice system. We have Sofia Santos, which is the head of International Relations Division, head of Portuguese focal point to the EMCDDA. She will have 10 minutes to explain the implementation of administrative sanctions and access to treatment instead of arrest, incarceration, or conviction. You have the floor, Sofia.
Hi, hello, good morning.
Sofia, my apologies. We would like to ask you to speak as close to the microphone as you comfortably can. You are very far away and very distant for interpreters. Thank you.
Okay. Is it better now?
No, it is not better. Is there any way for you to move closer to the device, to the microphone?
I can change the headsets, maybe. Let me just...
let's try to do that. Apologies to everyone.
No, no worries. Yes, hello?
That is significantly better. Sofia, please go ahead.
Okay, so I apologize for this, and good morning to all of you, and thank you for the opportunity to present the criminalization of drug use, the legal framework that Portugal is implementing since 2001, and in fact is another example of alternative to incarceration that promotes to people who use drugs the appropriate health and social services. By the end of the 90s, though Portugal continued to have one of the lowest levels of illicit drug use in Europe, we were one of the highest prevalence countries for problematic drug use. Drugs and drug addiction became a social, health, and political problem, and most addicts, they were afraid of entering programs because they feared to be referred to the criminal justice. So by that time, we had around 1% of the Portuguese population were problematic drug users, 98% of those were heroin addicts, and 48% were injecting drug users. The HIV infection among drug users represented 56% of the total number of infected people, and we had 350 overdoses per year. To face this problem, Antonio Guterres, the current United Nations Secretary General, that at the time was the Prime Minister, he set up a commission to develop the first national strategy on drugs, which was approved by the government in 1999 and included the recommendation to decriminalize drug use and possession for personal use. And the principles defined in 1999 in the strategy, they still valid today. And these principles were a policy that envisaged a balanced approach between supply and demand reduction measures. Drug addiction is understood as a disease, and people who use drugs as citizens in need of treatment, having much more to benefit from the accessibility to healthcare and social support than imprisonment. And a policy which comprised prevention programs, a treatment and harm reduction network, and reintegration programs aimed at recover people who use drugs. A new law was approved by the National Parliament and entered into force in 2001. And this law introduced a radical change in the way of facing drug use. The consumption and possession for use is still illegal, but no longer a crime, sentenced with imprisonment and not mentioned in the criminal record. So the use and possession for personal use is now subject, since 2001, to administrative sanctions in the case that it does not exceed the quantity required for an average individual consumption during a 10 days period. And these quantities are defined by law for each of the substances. So the main purpose of this law is the dissuasion of the consumption, and the basic concern has been to give priority to treat offenders instead of applying sanctions. This legal framework does not promote the impunity of the consumers or traffickers, rather the contrary. It allows quicker interventions among those who use drugs. In order to apply this law, commissions for the dissuasion of drug addiction were created nationwide, which allowed the relief of the criminal courts from the burden of dealing with situations of mere consumption. So those commissions are bodies under the Ministry of Health, and they seek to inform people and discourage them from using drugs. They have the legal capacity to apply administrative sanctions, but mostly look forward to assessing the user's needs. The commissions act as a second line of preventive interventions, evaluating the personal circumstances of drug users referred by police and directed them to the appropriate responses, treatment, or others. So in practice, how does it work since 2001? So when an individual is caught with a small amount of drugs for personal use, the police does not suspect of evidence or have evidence of trafficking, these drugs are seized by the police and the case is sent to the commission. The police report is carried out immediately, and the offender must be present to the commission in a delay of a maximum of 72 hours. If the police authorities believe to be in presence of a trafficking situation, so they will send the matter to the court and the criminal procedure takes place. So the commission then makes a psychological and social evaluation of the offender and will then apply the appropriate decision according to the profile of the individual. If the offender is not willing to undergo treatment, the hearing is suspended and the technical team tries to persuade him to accept treatment through some motivation work. So the implementation of the law is based on a network approach. Allocate resources and establish partnerships are of utmost importance to develop action and help the offenders to find their own way. The coordination between the services with responsibilities in the area, both on demand and on supply field, are fundamental for the good working of the commissions and for the support to the offenders. The articulation with the police authorities is essential, as they are the ones who initiate the intervention procedure near the drug users. The sanctions applied by the Commission can be a fine, only applied to non-addict users, or a non-monetary sanction, such as the prohibition to carry out a profession, to frequent certain places, to leave the country, periodic presentation at the place to be specified by the Commission, community service, among others. This slide gives an overview of the global figures on the implementation of the law since 2001 until last year, with the total number of people in contact of the commissions and the number of non-problematic drug users referred to specialized support, as well as the number of those that were referred to treatment programs. When we compare the situation in 1999 and today, we notice the considerable reduction of the number of problematic drug users from 100,000 in 1998 to 33,000 in 2021, an important decline in infectious diseases by HIV among injecting drug users from 56 in 1998 to 30% last year, and also a substantial decrease of overdoses from 350 in 1998 to 74 last year. If today we observe a general positive trend of indicators, this is mostly due to an increase on a set of public health-oriented measures that acquired a bigger coherence with the legal framework of decriminalization. So 22 years after the implementation of this policy, in more recent years, there is a small increase on illicit drug use among adults, but several relevant gains are identified, such as the reduction and delay in experimentation of drugs among adolescents, a significant reduction of injecting drug use, a reduction of opioids-related deaths and infectious diseases, a reduced pressure of drug offenders in the criminal justice system, an increase in the amounts of drugs seized by police, and a reduced stigmatization of people who use drugs. So in short, Portugal decriminalized all drugs, but didn't legalize them. And the Portuguese policy on drugs encompasses a model of decriminalization as part of a broader approach designed to prevent drug use, removing criminal sanctions that are ineffective and increase stigma. Instead, significant investment has been made in prevention, treatment, social reintegration, and harm reduction measures directed to public health concerns with social benefits to all. Thank you for your attention.
Muchísimas gracias a Sofía por ilustrarnos sobre la despenalización del consumo, aunque este sigue siendo.
Thank you so much for talking about decriminalization of use, even though it continues to be illegal, but you illustrated how resources can focus on other aspects rather than criminalizing. Now we're going to hear from the Subdirector of Organized Crime and Drugs at the Ministry of Public Ministry in Chile, who will talk about different deflection models during the prosecution process, either with the prosecutor's office or the courts. Go ahead, Lorena, you have 10 minutes. Thank you so much, everybody. Can you see my presentation? Yes, ma'am. Thank you very much. Greetings, and thank you so much for the invitation to today's session. In my role at the prosecutor's office, I am currently in a highly complex unit that focuses on organized crime-related crimes, but I have focused on being a coordinator for Alternatives to Incarceration, or ATI, and we provide support to countries, especially in terms of training, but also in my country, I've been asked to collaborate in terms of giving this presentation as part of this global coalition against the threat of synthetic drugs. I'm giving you this little bit of background information because I believe that one of the biggest problems that we face worldwide, and especially us who are part of the criminal system and also the decision makers at the political level and other government areas, we need to face two challenges that require coordination in our response, be it a criminal response or administrative, with solutions that have been implemented, like what my colleague Sofia Santos said, and these commissions. And I am pointing this out because oftentimes the focus of the issue is on people that are used for drug trafficking purposes, and they are victims, and they become they are offenders and victims at the same time of crimes such as trafficking in persons. And sometimes we are able to extract this person and prevent the court system from consider this person an offender and a victim instead. And this is something that I believe is very important to highlight. Now, on the other hand, we need to raise awareness because we are facing a threat. And I'm going to give you more context during my presentation. I'm talking about very dangerous synthetic drugs, and we see this with fentanyl in North America, Europe, and also opiates. And we also see ampoules for fentanyl and also solid fentanyl. So it's only a matter of time before we have people that come in contact with this drug and the very serious consequences it has on the users and society at large. Since I do not have a lot of time, I'm going to start going through my slides. Just as background, historically, we have seen drug users being sent to jail in different contexts, and this increases the rate of recidivism and with no reduction in problematic drug use. That is why several initiatives like the ones we've heard about today include, deflection before and also during the criminal proceedings. And after the criminal proceedings, we have alternatives to extract the drug user, on the one hand from the court system, and on the other hand, given the option to the system to impose administrative sanctions. An example we have is drug courts, which were born in the United States in 1989 in Miami, and currently there are over 3,000 of these drug courts throughout the United States, which means there's a lot of alternatives that can be implemented in different areas in the criminal system, from preliminary conflict resolution stages all the way through the phase where the criminal offender is fulfilling their sentence. As part of these ATI options, we have focused on actions that involve deterrence, that is to say, to deal with the case before opening a criminal case. Like Jac or Sofia said, the idea is to single out the user, people that are consumers or users or could become potential users, and we provide them with alternatives to incarceration without getting to the criminal system. So we can extract the person right away and involving the person in some sort of treatment, or to provide alternatives to the person and bring them before this deterrence court or some other option with, for example, proportional sanctions if they are to go through criminal proceedings. And also we have the measures the actions that can be taken during criminal proceedings. We must also remember that in countries such as Costa Rica, these groups can also be classified as particularly vulnerable, which is what happens oftentimes with organized criminal organizations that attract women for trafficking in purposes or child labor because they are highly vulnerable. So here we have the case of Portugal that we also have heard about. It was also a case in Jamaica that decriminalizes public use and cannabis use. Before 2015, possession of cannabis was criminalized and the person could be sent to prison. We also see the case of Germany, which enables a prosecutor to refrain from taking the person to the criminal proceeding in case the amount of drugs is low enough, and also a case in Washington, the case of Washington in 2001, which is also an example of deterrence, and it's for people that are also facing jail because of drug trafficking or prostitution charges. We also see a very interesting program that I wanted to connect to the example in Chile, and that is the case of alternatives in this HOPE program that is implemented in Hawaii. The idea is to lower recidivism rates and also to have people have alternatives to incarceration. Chile also deals with criminal cases when there's a sentence, especially for teenagers that are facing legal penalty. They are given the option to go through treatment which complements supplements the treatment that they have to follow that is mandatory. This other complementary treatment allows them to swap their sentence to something lower as long as they stick to the terms and conditions of the treatment. Now, during the criminal proceeding, we have seen different cases, and here we have the example of Panama that has an inquisitive system which poses a greater challenge for implementation. Also the case of Mexico that has a federal system, and therefore there's differences between programs. The case of Costa Rica that highlights vulnerable groups and restorative justice programs, and then Dominican Republic, which has focused their efforts on lower court judges that are part of this process of providing alternatives to incarceration to defendants. Now, the Chilean model was implemented during the criminal proceeding and implemented the drug treatment court, which is known with the acronym TTD. This can be implemented from the person that comes into contact with the criminal justice. A precautionary measure is enforced, and that's that person is deprived of liberty at that point, and they are immediately referred to drug treatment. So the person may have different options. The sentence might be suspended if treatment is successfully completed, and the case may be expunged from their record if everything is fulfilled satisfactorily.
And as I mentioned, the case of application during the sentence. In this case, as we said, that gives the opportunity to the teenager, to the young person, who can substitute a sentence for something of less intensity. This is, although the idea here is that they would have, this is a strategy that will allow them to rehabilitate. And in the adult population in Chile, we have had conditional suspension of proceedings, and when the system goes into the criminal system, you can negotiate with who would allow drug treatment to be added as part of the sentence, and that is executed through a treatment program during with psychosocial interventions, and that is approved by a judge. And this, the important thing here is that in this case, we also have a subsequent treatment. In other words, a person, we've been able to reduce relapses of consumption, and so we determined the terms of treatment. Yes, I'm wrapping up here with just this last line. By doing this, what we are doing is we are giving the opportunity to an individual to be reinserted in society through training programs and providing them with the ability to reinsert at the right time. This is part of the criminal process and how we're doing it. We thank you for the attention and listening, particularly when this last part speaking about Chile's experience. So thank you, Lorena. We will open up now for some comments directed at certain countries. We'll begin with Iwong Orlando, who is the Interim Director of Public Education and Advocacy for the national campaign against the use of drug abuse in Kenya. You have the floor.
Good evening, everyone, and Jambo from Kenya. I hope I can be heard.
Yes, please go ahead.
Thank you. So Kenya has tried to domesticate alternative to incarceration. What we have done so far is we have an ATI committee, a steering committee, that brings together both people from the public health here and the ones also from the criminal justice system. So the ones who are in the committee, we have from the Ministry of Interior and Administration through NACADA, which is the National Authority for the Campaign Against Alcohol and Drug Abuse. So NACADA is mandated with issues of supply suppression and demand reduction. Another member is the criminal justice system. Here we have the National Council on Administration of Justice. We have the judiciary. We have the Office of the Director of Public Prosecutions. We have National Police Service. Under this, you have the Kenya Police, Administration Police, and Directorate of Criminal Investigations. We have Probation and Aftercare Services, and the Kenya Prison Service. Under healthcare, we have the Ministry of Health and NASCOP, who are in charge of issues of HIV and methadone. Under the community service organizations, we have M.P.A, we have Reach Out, Omari Project, and other programs supporting. So all these agencies are supporting the ATI. What we have done so far, with the support of UNODC, we've been able to have 3 targeted multi-agency workshops. And these workshops were to come up with particular interventions, principally starting with diversion, deflection, and then we continue. So we've had a training for policymakers on ATI. This was done in September of 2021. After that, we had a follow-up workshop to come up with the ATI committee. And the idea is when we have this committee, then we are sure that interventions will be done. The ATI was formed in November 2021. We had a follow-up workshop to come up with the action plans. What we've also done is on our action plans, we have now started with Mombasa. Mombasa is our coastal area, which is unfortunately the most exposed when it comes to heroin and cocaine. And we are happy that even this week, UNODC has been able to support, and we are happy Jac is there with a training for case care management, so that both people in the criminal justice system and the healthcare can be able to intervene appropriately. And we're also doing a training on overdose management. What we've noted so far in Mombasa, the police know the people who use drugs. And as Jack mentioned, when these people are found, when they're arrested in possession, or they have grabbed somebody's phone, or they have pulled somebody's golden earring and they're running away, and they're about to be mob justed, then when the community has surrounded them, the police actually rescues the person and calls the civil society on the ground and tells them, come for your person. We are giving you a timeline, come for your person, because we realize this person needs help. We've also seen people who have the methadone card, that they're attending methadone clinic. Even when they're arrested and they show their methadone card, the CSOs are called. And you're told, come for your person very fast before we take them to the police station. And we're happy with this because it shows that law enforcement is interested in protecting people who are using drugs and are in conflict with the law. When we have Shimolatewa Prison, Shimolatewa Prison also has a court within it, and we're also happy that it has a methadone clinic. So sometimes we have offenders who end up in front of a magistrate, and we're also happy because the magistrates within the Shimolatewa court are able to deflect. So once they're able to divert, once the people have been brought before them and they understand that you have a problem with a drug or you're suffering from withdrawals, they actually call us. They call
Estimada Ivonne, estamos en tiempo y debemos de dar paso a la siguiente intervención.
I'm sorry, but we're out of time. We need to allow time for
just
the next
1 minute.
intervention.
So the court there is able to divert the person, and we're happy this is going on. Thank you very much.
Gracias y disculpa el corto tiempo.
Thank you, and I apologize for cutting you off. Next, we will give the floor to Michelle Mayorga, the Criminal Justice Director in Costa Rica. Good morning to everyone. I would like to share the experiences here of Costa Rica through restorative justice. Currently, this model is designed so that people who get involved with the justice system through an interdisciplinary body that has psychosocial and legal and clinical services is an integrated program so this provides solutions or alternative routes that to the traditional justice system. And restorative justice allows a multidisciplinary approach in applying alternative solutions to the problem, including alternative sentences. The purpose here is to minimize imprisonment when these people comply with a number of requirements that are established for each person. Doña Lorena already mentioned some of the characteristics of the model that we have currently going through a legal proceeding that has been set up since 2019. We're allowed to work with different populations: women, men, adults, and minors, people who are in vulnerable situations. We have different focus, different approach for each of those, always in an integrated approach. We also are able to apply this at different phases of the process. So pre-trial, during the trial, and in fact, in the post-trial section, we are able to offer people this option, even when they have gone all the way through the criminal process. This model focuses on people, accepting them at the place where they find them in terms of their conditions and their needs. We're trying to take a more humane and integrated and integrating approach with people to try to minimize stigmas and the burden that the traditional justice system can place on them. I don't know if I have a few more minutes, but I would like to highlight that in addition to the success that we've had by this humanizing approach in introducing this into the criminal justice system, we also see high levels of compliance, over 90% compliance for these alternative resolutions and 95% success rate with alternative sentences. So the users are the people who are at the center of this model, and it is they who have shown us this high rate of satisfaction with the treatment that they are receiving, of the professionalism in the response that they face in response to an original crime. So that's what I wanted to share about Costa Rica's experience. I hope I've been concise. If anybody has any question, feel free to communicate with me through the chat. Thank you. Have a great morning.